started Alpha Health Services in 2013 with the vision of providing Toronto and the surrounding community with the most effective, efficient, one-on-one rehab care that we could offer by what I consider the best practitioners in Toronto.
Tell me about the early days of Alpha.
Oh, the early days of Alpha was me alone in a room with some of the best patients in Toronto, really trying to continue to learn my skills as a physiotherapist and start to build a business and build a clinic with practitioners that mentored me, practitioners that taught me, and new grads that were, inspired to make a difference in the private healthcare world, and starting to build that team from a one-room office at Yonge and Eglinton with no admin staff, no admin support, and just taking it one day at a time to build the Alpha name from the grassroots up. In 2013, we opened our first clinic location at 55 Eglinton West, near Yonge and Eglinton in Toronto. In 2014, Joanna Schechter, registered physiotherapist, mentor of mine, clinical instructor of mine, was the first physio after me to join the Alpha team. And I was over the moon excited, as she was instrumental in my career, continues to be instrumental in my career, and was willing to take the risk and the plunge with me to develop Alpha into what it was today.
So I met Charlotte in 2011. I came back from mat leave and I was working in inpatient rehab, and she was my student for her inpatient stroke placement. When I left working in hospital, and Charlotte and I were able to reconnect, and she asked me to be part of her team here, and I said yes. Okay, so when I joined Alpha, it was at 55 Eglinton Avenue East, and it was a small clinic with a desk at the front and just two rooms. And Charlotte was in one room and I was in the other room, and there were many times where there was no one there. It was very quiet. It was very adorable.
In 2014, we opened our first satellite clinic to serve students, staff, and teachers at Havergal College, located at Avenue and Lawrence in Toronto. In 2015, we moved Alpha to 40 Holly Street, Suite 901, because we needed more room. We needed more treatment space. We stayed in the Yonge and Eglinton area, but we did move down the street to a larger space in a bigger building. In 2015, we also opened our second satellite clinic that was seasonal, running from end of May to the Labor Day weekend in Muskoka, Ontario, to serve clients and patients in that area, as well as our Toronto patients that would be up there in the summers, and the students that may be up there for various jobs in the summer as well. In 2016, we added two incredible practitioners to the team. Karen Kingsley, our registered massage therapist, that was a gift that came into my life, and the moment we met, we clicked. And since then, she's worked full-time as our registered massage therapist with a waiting list a mile long.
I was a fairly new grad. I started practicing at the end of 2015, August of 2015, and I was looking for a new clinic in Toronto, and somehow I found a job posting for Alpha Health Services. And I'm like, okay, cool, this is at Yonge and Egg, it's convenient. And so yeah, that's when I started. It was probably February of 2016.
What was Alpha like when you joined?
So when I joined Alpha, it was such a small clinic. There was Charlotte, there was me, and I believe there was Joe and maybe another therapist or physiotherapist. So it's just the three of us in this little clinic, and we were all just establishing ourselves and trying to get as many patients as we could through those doors. So yeah, I was just a baby therapist, and it was a very quiet environment at that time. I do remember the first time I stepped through the doors, and I remember it was Deb. So Charlotte's mom was manning the front desk, and then Charlotte coming in with like her, big personality and big smile and welcoming me to the interview. And I fell in love with it from there on out.
In 2016, I also had the privilege and pleasure of having Leanna Mayer, registered physiotherapist and pelvic floor physiotherapist, join the team. Leanna is another physio who actually I covered her maternity leave on my very first job at a school, and someone else who, as a practitioner, as a person, is someone I'm incredibly grateful to have in my life, and has been incredibly instrumental in mentoring the physios at Alpha, at creating the dynamic at Alpha, and being a gift to any patient that's on her schedule.
I joined the Alpha team when I was ready to come back to work after I was on my second mat leave, and I was talking to Charlotte for a very long time about it, and I was very excited about the clinic that she opened, and I just needed to be part of it. So when I joined Alpha, it was very small. It was just Charlotte and maybe another physiotherapist and myself, and it was quiet. There really wasn't a receptionist that was working full time. That's pretty much how it started.
In 2017, Jennifer Harvey, registered physiotherapist, and Dr. Christina Carew, naturopathic doctor, joined the Alpha team at 40 Holly Street. In 2018, Olivia Martins, registered physiotherapist, was the next practitioner that joined the Alpha team. Since 2018, Olivia has been my right-hand physio in terms of developing the crew we have here and expanding the services we offer here. And today she is the director of physiotherapy, and I don't know what Alpha would do without her.
I was a year out of school, practicing in both the private orthopedic setting as well as the rehab side in rehab hospital, and wanted a bit of a change, wanted to join a more cohesive team, and Alpha seemed to be the place to start. When I joined Alpha, the team was fairly small. Our clinic space was cozy, but there was a nice warm environment and community setting to the private practice that we are working in.
In 2019, Babs needs no last name because he was the first male to join the Alpha group as our podorthist at our 40 Holly Street clinic. In 2019, Ashley Saltzman joined the team as clinic director. Ashley has changed all of our lives and has kept all of us on track by really allowing us to expand the administrative options that we offer to patients, and working with the practitioners to support us, to keep us in line, and to help make Alpha what Alpha is today. In 2020, like the rest of the world, Alpha faced COVID-19, and that was a very, very challenging time for the clinic. And there were days that I didn't know if we were going to be able to keep our doors open, and if it wasn't for the dedicated and incredible team we have here, and Ashley and I working late into the night to figure out how we were going to make it work, we wouldn't have been able to keep the doors open. But we made lemonade out of lemons, and we also had the opportunity at this time to renovate and expand the physical presence we had at 40 Holly Street. With this expansion, we were able to add 5 new treatment rooms, a staff area, and a full rehab gym, which has changed who and what we can do in this clinic and has allowed us to operate within the protocols put out by COVID-19 because we do have the physical space. In 2020, we had a big year at Alpha. Rebecca, Allison, Paula, and Priscilla all joined the team as registered physiotherapists at 40 Holly Street. The renovation to our space came with the opportunity to bring on more practitioners and new services. In 2021, Dr. Jim New, sports medicine physician, and Augie Bovan, registered kinesiologist, joined our incredible team of practitioners. In 2021, we opened our second physical location in Toronto at 1 Bridgepoint Drive at Bridgepoint Active Healthcare. This was an incredibly exciting opportunity, and Emily and Kristen were the first two to jump on Team Alpha East and run the show down there.
Alpha East is the first private practice clinic located in a public space, and I honestly think it's an idea that is brilliant and should have been done earlier. I think it's a really great opportunity to work with physiotherapists and other healthcare practitioners in the public space and try to sort of break down the silos and hopefully impact this sort of trend elsewhere in the public space.
What excites me the most about Alpha East is the potential here. There's so much room to grow. We're just kind of starting out in this community. There's lots of opportunity with the staff here at Bridgepoint as well as the inpatient population. And I just can't wait to create the same Alpha vibe that's up at Alpha Midtown.
Alpha East is an incredible opportunity and a bit of a game changer in our health system in that we are located in a public rehab hospital, and we are attempting to start to bridge that gap between public rehabilitation and private rehabilitation for patients in Toronto and the surrounding community. We also added Austin, registered massage therapist, Natasha, Pilates instructor, and Joel, registered physiotherapist, to our Alpha East crew.
So Alpha today it's a full business. It's a family, and it is becoming an empire. It's really come from this tiny little seed, and now it's this full flower with different therapists and different rooms and equipment, and it's really grown into, a full-fledged business with really wonderful people who are all, working together.
It just grew. It's crazy. Now we have double the space, triple the practitioners here. So it's become a really fun family to be a part of.
Alpha today is a bright, thriving, exciting place to be with lots of young energy and obviously an incredible front staff, and just lots of equipment and space, which is very exciting.
Compared to before, we've definitely grown in size or space. We've expanded our current space at Yonge and Eglinton, and we've now just added in a second location. Size in the sense of the number of practitioners that are working with us now, and the services that we offer. So we've really grown to be a bit more comprehensive, covering all of the healthcare needs of our community.
Alpha has changed greatly over the last 8 years. Alpha started as a one-woman shop in a very small room in a very small building at Yonge and Eglinton with me and a physio table, and it has evolved to being a family and a place where we get people better, where we have fun, where we push the envelope, where we challenge our practitioners to be the best in their field, and where patients come needing support, needing help, needing rehab, and they walk out our door returning to the life that they wanted to return to. And the fundamental value system and operating mission statement of Alpha has not changed. We've just grown, and we've been able to add people to our team, we've been able to grow our services, and we're not done. We're gonna keep growing and continue to serve our community and serve our patients the best that we can.
honestly don't know what it is. I just think there's something in the water at Alpha. Like we have a hand-picked group of healthcare practitioners, admin staff, people who are all really passionate about the same thing. And I think everyone's really friendly and willing to work together, and just passion above all.
Alpha is a special clinic to work at because we have such a tight-knit group of practitioners that makes it just a great place to work. The environment is great, and the community that we bring in as clientele makes it just feel like a family dynamic that is still 100% professional, but just a fun atmosphere. And another unique aspect to Alpha is that it fosters growth among our individual practitioners, and if they want to go down different routes in their practice, as well as the ability for the clinic to continue to grow, to cater to different parts of Toronto, the GTA, and who knows where else.
What makes Alpha special, I think, is that I think we really care about our patients. I think we are an amazing group of people that work really well together, surprisingly enough, especially with so many females in one spot. We're a family.
Alpha is very unique because it has somehow managed to bring together a group of people who all share the same values that involve supporting each other, creating a really unique family type environment, and that we also really support the education concept, kind of supporting each other and learning from each other, and that's what I love about Alpha.
My dreams for Alpha are continuing to serve the patients in the Toronto, Ontario, Canada, with the best, most comprehensive, efficient, and effective healthcare that we can provide. I want to continue to bridge the gap between the public and private sectors, and I want to continue to grow our practitioners, the services we offer, the regions that we can deliver, and the patients that come into our care that walk out our doors able to do what they need, want, and love to do.